because this gut microbiota that alters the chronic inflammation of our body, chronic micro-inflammation or low-level inflammation of the body. It is influenced by this gut microbiota, and in the recent studies, it is concluded that this low-level micro-inflammation ongoing in our body is responsible for most of the chronic diseases like insulin resistance, increased blood pressure, and dyslipidemia. Other than that, this chronic inflammation or chronic inflammatory mediators, mostly mediated or initiated through this lipopolysaccharide component of gram-negative bacteria, they play a major role in the initiating various chronic diseases affecting various organs. Likewise, we divide them in gut brain axis, gut liver axis, gut lung axis, gut skin axis, etc. Based on these chronic inflammatory mediators, various effects in the various organ systems. So in the liver, in the muscles, in the pancreas, this low-level microinflammation or low-level chronic microinflammation causes increased inflammatory mediators that lead to insulin resistance, obesity, elevated blood pressures, and dyslipidemias. This gut microbiota, through its normal constitution, definitely it is more important to alter these disease conditions. Definitely, what we can see nowadays, particularly in our country, most of the patients, they come with multiple drug uses, or you can say multiple drug abuses. Most of them are antibiotics, undue antibiotics that alters this gut microbiota, lifestyle, sedentary lifestyle, polypharmacy, all these things, they alter the normal gut microbiota, leading to increased pro-inflammatory markers, leading to various chronic diseases. So in these such settings, if the patient comes with initial stage of diabetes, mildly elevated blood pressure, these probiotics alone, they can tackle the problems by reducing the insulin resistance, by reducing the blood pressure, by reducing the obesity, and by improving the lipid profile. And in the patients having high level of diabetes, high level of dyslipidemias, these probiotics, they can be used as an add-on therapy. We can co-prescribe them with the other oral anti-hypoglycemics, anti-lipidemic drugs, and antihypertensives. So definitely these changes are coming. They are being practiced nowadays. Awareness about this gut microbiota is increased definitely. Research is going on. Newer informations are coming daily. So in the coming future, immediate future, use and proper use, I can say proper use of this probiotic and prebiotic combination can be more utilized, and it will be more and more will be co-prescribed with the other drugs for the chronic diseases. Definitely, what I told you that this gut dysbiosis is one of the causes or one of the root causes of these chronic conditions. What you mentioned, diabetes, heart diseases, and dyslipidemias, lipid disorders. So to correct this dysbiosis, gut dysbiosis, it is very important to use probiotics and prebiotics to correct the gut microbiota, or you can say dysbiosis of the gut. By correcting this dysbiosis, we will reduce the chronic inflammation that is going on, and by reducing this chronic inflammation, all the parameters, they will improve. And in our clinical practice, we use often these probiotics as a co-prescription in the selected and eligible candidates. where we suspect that this biases is the cause of or as add-on cause of this chronic condition. Yeah, definitely. What we see in this COVID that GI symptoms they are also there. Patients they came with the primary with the respiratory symptoms, but after recovering from the respiratory symptoms, what we see is there is chronic shedding of the virus in the faces. There is chronic prolonged GI symptoms like diarrhea. So definitely this COVID virus is affecting the GIT. Whether it is due to direct ingestion of the virus or whether due to reduced immunity in the chronic diabetic patients, chronically ill patients, immunocompromised patients, that virus can come through the blood and that can affect the gut system because receptors that are needed to be attached and to go into the cells for this COVID virus are present in the GIT also. So definitely GIT or our gut is one major organ affected other than the lungs, and by affecting this GI barrier, this COVID virus, what it does, it disrupts the protective barrier of GIT. That protective barrier disruption leads to systemic infection and spillage of the bacteria, pathogenic bacteria from GIT to blood, and was responsible for many deaths. It was observed in various studies that patients shedding viruses for more times in the feces, they were more serious and there was systemic involvement of the by the various pathogenic bacteria was more in such patients. So this COVID virus is definitely affect our GIT. It causes gut dysbiosis and it affects the immunity and our protection against the pathogens. So definitely this probiotic use is more important in such patients who are infected with the COVID and having the GI effect, GI symptoms. These patients should be properly treated with the use of probiotics for at least 12 weeks, and they show improvement. Definitely, in the borderline cases or at the initial stage of diabetes, dyslipidemias, and hypertension, this chronic low level inflammation is more root cause, or we can say responsible for these conditions. So, by correcting this dysbiosis of the GIT, maybe this dysbiosis cause maybe anything else, but we should correct this dysbiosis. By correcting this dysbiosis, we will reduce the inflammatory markers. By reducing these inflammatory markers, we can correct the main root cause of these chronic diseases at earliest or milder stage. If this disease has progressed, then we can use as secondary or add-on therapy these probiotics with the primary oral hypoglycemic agents and antihypertensive and anti-dyslipidemic drugs. Yeah, definitely. Not only single patient. Many of my patients they come with the symptoms of bloating, belching. These diabetic patients, they are most probably they are suffering from the small intestinal bacterial overgrowth. So in such patients, by correcting this dysbiosis, significantly it improves the diabetic gastroparesis. By improving this diabetic gastroparesis, their HbA1c control is very good. Postprandial glucose control is very good by improving this gastroparesis, and lipid profile of the patient improves. Blood pressure also improves. Not only in single patients, in so many patients. But we have to choose the patient correctly. We have to diagnose whether the patient is suffering from this gut dysbiosis or not. Then only we can see clear-cut results of this use of these probiotics. In such cases, minimum duration should be at least 12 weeks. Then only we can see the results. Definitely, various this oral hypoglycemic agents they causes metabolic acidosis, acid production, diarrhea, and bloating. Causes gastroparesis leading to small bacteria, intestinal bacterial overgrowth. So, by using or co-prescribing probiotics with these such or anti-oral hypoglycemic agents in patients suffering from side effects of these drugs, we can definitely correct side effects by using probiotics.